My name is Daniel Golshani. I'm a board-certified plastic and reconstructive surgeon. I've been in private practice for the past 13 years in Beverly Hills, California. My practice is mostly focused on aesthetic or cosmetic plastic surgery as well as reconstructive surgery. A very common operation that's performed by plastic surgeons is what we call a tummy tuck or abdominoplasty. Very commonly after having children, women experience laxity or looseness in the skin of the abdominal wall. That's commonly also associated with stretching and looseness of the muscles of the abdominal wall, which creates a bulge. And a lot of times even stretch marks, which may be above or below the umbilicus. Patients are generally very disconcerted about this. They're very unhappy with the whole look that they have, and they're very self-conscious about it. And when they present, they're ready to make a change that will allow them to have a flat abdomen, remove the loose skin, and so that they can have a relaxed time again. Go to the beach, put on a bikini, and be more social than they have been over the past several years having children. Abdominoplasty itself is a very safe operation. Again, we have to look for risk factors. For example, if a patient is a smoker, they definitely have to stop smoking several weeks before a tummy tuck because the chances of having complications are higher. I also want to make sure that the patients are not on birth control pills if they're going to have a tummy tuck because we want to decrease the chance of a blood clot. The procedure generally lasts anywhere between 2 to 4 hours depending on what we're performing. I always tighten the muscles in patients who have separation or stretching of the muscles, and I use a very special technique for that. The shape of the umbilicus is very important to patients, and so it is with me. We want to make sure we have a great result where the scars are invisible or they're hiding within a bikini line. We want to get the best results possible. A lot of times at the same time I perform lipectomy, which is direct removal of fat, or liposuction in areas that are safe that will not create problems with the outcome of the tummy tuck. And to make things even more complex, with the advent of fat grafting or autologous fat grafts, some of the fat that is removed at the time of tummy tuck or liposuction can be replaced back, and these have very good outcomes. I have been doing autologous fat grafts for the past 10 years at least, and we can augment the buttocks, create fullness in the buttocks that may be lost over the years because of aging. Some patients will have flattening of the cheeks, aging of the face, by just injecting some of the fat that has been prepared specifically for the face with what we call a centrifuge. We can improve with no incisions, just from a use of a needle. We can inject fat in the areas of the face. The fat is a living transplant. About half of the fat survives and stays there permanently, and has very aesthetically pleasing results. And again, fat grafting cannot be done in everybody. It has to be done correctly. It's a very artistic process, and you can't just inject fat and hope for the best. But when it's done correctly for the right patient, it can have an excellent result. Abdominoplasty, I think, is one of the big slam dunks of plastic surgery. Patients have tummy tucks all the time in my practice, and it's a life-changing process. Even though it's a simple operation for many people, I believe that it's a very gratifying operation for many patients. It changes their lives. They become active, feel self-confident, change their wardrobe, get a new job. It's amazing what things you see after you perform a tummy tuck.